In a moment, I'll be joined by Dr. Maria Van Kerkhove. She is the lead scientist or the chief technical head of COVID-19 for the World Health Organization. She's going to be joining me from Geneva. Dr. Kerkhove will be with you in a minute, but I just want to put before our viewers just the context why we have you also on the show, because across the world, there is good news and bad news, because as the battle for soccer and Wimbledon and the Olympics later this month continues, the fact is large numbers of fans could make these events into super spreaders. We are already seeing that with the Euro soccer. Take a look at how sports could become the next big super spreader. The World Health Organization issuing a word of caution, asking fans to assess risks before traveling.
Euro 2020. 24 of the continent's best battling for one of soccer's most prestigious titles. How could fans then keep away? Tens of thousands crisscrossed 11 European cities following their team's fortunes. It couldn't be held as scheduled in 2020 because of the pandemic. This year, despite several red flags, UEFA was hell-bent that the competition could not be delayed any further. But now, those red flags are here to haunt.
Last week, the number of cases rose by 10%, driven by increased mixing, travel, gatherings, and easing of social restrictions. This is taking place in the context of a rapidly evolving situation. A new variant of concern, the Delta variant.
The World Health Organization now believes that the tournament could be a super spreader event.
I am not here to cold shower any Euro 2020 fan or anyone's holidays. But before we watch our players and before we all pack and go for some well-deserved rest near home or far away, assess the risks carefully.
Which it is. And it's tucked in.
Forget social distancing, even masks were a rarity in the stands. Few stadiums had a cap on people. Most were packed to the rafters. A recipe for disaster during a pandemic, and nations are fuming.
I think that UEFA's position is utterly irresponsible, because we are living in a time of a pandemic, and especially in such countries as Great Britain, the dynamic of infections is very strong, and we all know that. Of course, contact precautions and certain hygiene regulations are indispensable in order to overcome the infection one day.
Long before the kickoff, two cities, Dublin and Bilbao, dropped out, saying they would not be able to adhere to COVID regulations. In hindsight, it now seems they saw what the other European nations did not. Bureau Report, India Today.
So are sporting tournaments turning super spreaders? Remember on your screen right now, visuals from Euro 2020, the big soccer extravaganza, which has started the surge in cases. Also the ongoing annual tennis championship in Wimbledon, where again, spectators now without social distancing there. Tokyo set to host the biggest sporting event, the Olympics, in just a few weeks. Residents there holding protests against the games. What does all this mean for the global fight against coronavirus? Joining me now, Dr. Maria Van Kerkhove, COVID-19 technical lead at the World Health Organization. Appreciate your joining us, Dr. Van Kerkhove. How do you respond to what we are seeing? The WHO warning new coronavirus cases across Europe rising by 10% over the last week. Are sporting events becoming the new super spreaders?
Well, thanks very much for having me on your show. The reason this virus spreads is if we provided opportunities, it will. There are a combination of factors right now that are contributing to the increase in spread. One of them, as you mentioned, are these virus variants, the Delta variant in particular, which has increased transmissibility. The other is increasing social mixing. And social mixing can happen in a number of different ways. It can happen in these large sporting events. as you've pointed out, but it's not just the event itself, it's all of the other side events, meeting in the pubs, meeting on the streets, all of the other side events related to each of the ones that you've mentioned there. We have increased social mobility. We have the relaxation of public health and social measures. These are measures that we know prevent infection. And we have really low levels of vaccination coverage around the world. That combination of factors puts us in a very dangerous situation. And when you have a variant like the Delta variant that can transmit more easily, you will have these events. Super spreading events instead of super spreaders, which indicates that it's a person. Super spreading events are events where you would have more transmission than otherwise expected. These can happen in a number of different locations. And if the measures aren't in place, again, at the event itself or the side events, then you can see some increased transmission, yes.
I'll come to the Delta variant in a moment, Dr. Van Kerkhove, but I just want to understand, where does this leave the World Health Organization or indeed governments? Because governments were supposed to ensure COVID protocols, ensure that the unlocking followed certain rules, there would be masking, there would be social distancing. But across the world, what we are now seeing is people giving the citizenry, giving a go-by to those protocols.
Yeah, so what we do is we work with governments to assess, take a risk assessment for each of these types of events and looking at what are the plans in place, what are the protocols that are in place for early detection, for surveillance, for the physical distancing, the ventilation, the use of masks, et cetera, and advising them on how best to do that. When we see these events, where people are coming together, it's likely that you will see an increase in transmission, especially if the vaccination coverage and the 2 doses or the full course of vaccination is not at a high enough level. We're starting to see increases in cases in a number of countries of individuals who are coming back from these events. We've seen increases in Finland, in Scotland, in Denmark, in the Netherlands. And we are very grateful for countries that I've just mentioned who have good surveillance systems in place to detect those cases coming back from those events. We want to prevent them in the first place. But this is something that we have been warning about, and there are consequences to these events. We need to be ready to act fast to try to limit the spread, prevent them from happening in the first place, but limit the spread if there is transmission that is occurring.
Let me be more direct with you, Dr. Van Kerkhove. Are we heading for another wave? Are we heading for another global wave, which could even extend to the United States, to the United Kingdom, to the rest of Europe, and dare I say even countries like India, that as COVID protocols are not followed rigorously, as the Delta variant, as you said, more infectious spreads, we could be heading for another wave?
Well, that's a really good question, because the entire world right now remains very fragile. With these 4 factors that I outlined, the variants, the relaxation of public health and social measures, the increased social mixing and social mobility, and vaccine unevenness and inequitable distribution and use, puts us all in the risk of having further peaks, further waves. This is not a virus that transmits, that has that seasonality like influenza. We may start to see a seasonal pattern, but right now, if we allow this virus to spread, it will. And so we remain at risk to be able to capture these incidents as it just starts to increase. And that's why we need really good surveillance in place. We need good testing in place. We need good genomic sequencing in place so that we could detect mutations and variants. We need good isolation and clinical care. We need all of those factors. And if we don't have that comprehensive approach, yes, we are at further risk for future peaks, future waves.
You keep mentioning surveillance, but equally critical, and you briefly mentioned, that is vaccinations. And we're seeing that even in India at the moment. While vaccinations are at a reasonable level, they're still nowhere close to where they need to be to ensure that we are fully protected against future waves. So is there an idea, is there the fear that the waves will come and outpace, the variants come in and they outpace simply the pace of vaccination? We're seeing it in Russia. Very low levels of vaccination, and suddenly the number of deaths have increased in a country that is hosting the Euro soccer. And the fear is that in India, if the vaccination drive doesn't pick up further by the end of the year, then we again are in a way susceptible to variants like the Delta and indeed the Delta plus variant.
So the Delta variant and its sublineages, in fact, we don't use that nomenclature of Delta plus. The AY1, the AY2, it's the B1617.1 and the B16.7.2. They're all the Delta variant, and those are all variants of concern. The Delta variant and its sublineages are variants of concern. The virus is mutating and is evolving, and that's evolving faster than we can vaccinate people. And that's because we don't have enough vaccine around the world. And of the billions of doses that have actually been administered, the 3 billion doses that have been administered so far have really largely been administered in a very few number of countries. If we had used those differently for the high-risk workers, those who have underlying conditions, our frontline workers, we could be in a very different situation epidemiologically. But without enough vaccine, we have to continue to rely on all of these other measures. I say many times, I'm a broken record on this, it's vaccines and not vaccines only, because we will not have enough vaccines to bring the virus under control. It's the public health and social measures, the surveillance, the testing, the clinical care, plus vaccination that is what's going to bring this virus under control. And I just want to touch upon this idea of fear. I think what we really want people to come away with is empowerment. We need people to understand that every single one of you that is watching right now, every single leader has a role to play in this. What you do every day and the decisions that you make to take this risk-based approach, take the measures that you can to keep yourself safe matters, because every single infection that we can prevent gets us closer to ending this pandemic. And it all matters. All of this matters, the decisions that we make.
No, but then, Dr. Van Kerkhove, are you suggesting, for example, that in countries like India, where we are at what? When it comes to double jabs, just about, covered about 4 or 5% of our population, of our key core adult population, long way to go, that we remain under lockdown conditions? I mean, there will be those in Europe who will say, look, the Euro soccer and Wimbledon and indeed the Olympics a few weeks from now are a moment to celebrate. There are others, including in Japan, who are saying, look, this is not the moment to hold the Olympics. There are those in Mumbai who will say this is not the moment to open up the city. How do you achieve that balance?
So that's also a great question, because when I say the use of public health and social measures, and when WHO talks about this, that does not mean lockdown. It means using the measures that we have. Some of this may include a temporary restricted movement of yourself, not locked in your house and not the entire city or the entire country locked down. It's using targeted approaches where the virus is transmitting most intensively. How do you use your resources best? No, it is not realistic to expect that countries would be locked down until they get vaccination. That's not what we're saying at all. But what we are saying is use the tools that we have, and all of the tools that we have, the masking, the good ventilation, the avoiding crowded spaces. When I say avoid crowded spaces or avoid crowds, that doesn't mean being locked in your house. So it's really using these to the most effective way that you can in a time-bound way. So in an agile, making it more intense when needed and less intense when needed. But you need the public engaged, informed, engaged, and empowered to be able to adapt to the changes, because it's confusing. If we're changing our messages.
Dr. Van Kerkhove, you're on one side of the screen. Other side of the screen, I'm showing pictures of people celebrating in pubs after England defeated Germany in the match. None of them are masked. No social distancing. What happened? Should there be a penal system, a much stronger system of penalties? How are you going? It's now what? 15 months since the virus, more than that, since the virus struck, and people now out there feeling in a way liberated after 15 months of suffocation. This is what some people suggest. Don't want to necessarily, follow social distancing norms. So where does the WHO's protocols then take us?
Yeah, so I can't see those images next to you because I can't see you on the screen, but no, I've seen plenty of them, and I have to say it's incredibly frustrating for me to see. And I'm speaking personally here because we know that it's the event. There's a lot of precautions that are taken at the events themselves. And I'm talking about events in general. And you can think of backyard barbecues all the way through the Olympics, but it's those side events. It's the things happening at the pubs. It's the things happening outside. And we need people to understand that what they're doing increases their risk. If they are not vaccinated and have that full vaccine dose, and most of the world doesn't, that can fuel the spread. The challenge is that we do not see an immediate impact of that. The cases will start to show up a couple of weeks later. The hospitalizations will start to show up a few weeks after that. The severe disease and death will happen a few weeks after that. Everybody really needs to understand we are in this together. And it isn't fair that we see some countries, able to do some of these things and others not, because all of us are at risk, especially with the emergence of these variants.
No, but are we also, Dr. Van Kerkhove, in a situation where are you telling us that if we've double vaccinated, then I'm safe? Because, you know, that gives people a sense of complacency. Are we saying that, you know, if I'm double vaccinated, I won't get reinfected, or I at least won't get hospitalized? So, you know, that's the way forward.
Yeah. So having a vaccine is part of the strategy, you know, and having your full course is part of the strategy. And that protects you against severe disease and death. We do know that people who are vaccinated some can get infected. But the protection against the vaccines is for severe disease and death, and they are incredibly effective, including against the Delta variant. That's important. So it is important when it's your turn to get vaccinated. What we urge right now is the use of additional measures, the physical distancing, the use of masks, particularly when you're around or in close contact with other people who aren't vaccinated or you don't know your vaccine status, indoors, for example. All of those other measures need to continue to be adhered to for now, until we have enough of the population that it actually reaches that level of vaccination. And frankly, that's just going to take some time.
Yeah, you know, are you saying, though, that the Delta variant, which you mentioned half a dozen times, is that now not just a variant of concern, but quite simply the biggest global challenge we've faced since the outbreak of COVID, that it spreads far more, it's far more infectious, easily transmissible, and therefore in the next 6 months, that's the real variant to worry about?
Well, it is one of the major concerns that we have right now. It's not the only one. The virus is continuing to evolve. The more the virus spreads, the more opportunity it has to change. There will be other variants of concern. Even the Delta variant is evolving because there are mutations that are happening. You know, you mentioned that this B1617.2.1 or the AY1 or the AY2, yes. Those are additional mutations on top of the Delta variant. The virus will continue to change. So the variants will be a major challenge going forward, whether it's Delta or it's something else. This virus still has a lot of tricks up its sleeve, but in combination of that is the global fatigue that we all feel. We are exhausted of doing all of these measures all the time. We all want to know, when is this going to be over? When are we going to be done with this and we can get back to our normal lives? We can't do that yet until we get control over this virus. And unfortunately, in many parts of the world, we don't yet have control over this virus. And until we do, the challenges of the fatigue, the global fatigue we have to continue to adhere to these individual level measures or community level measures, the variants of concern, the uneven use of vaccines and not enough vaccines yet. All of these are major challenges. I wouldn't pin it down to one because I think that simplifies it too much. It's too many challenges that we face right now, and too many people have not yet received a full course of vaccination. Are
you going, therefore, is the WHO going to predict or forecast into the future and say, look, by December 31st, 2021, the world will be in a better place, 2022 will be a year when we can finally believe that we've got the better of the virus? Or it's impossible, you're saying, to make those predictions?
Well, my goodness, I hope so. Hope is not a strategy, though. And so I take comfort in the fact that we know what works. We know the plan. We have the plan of how we can gain control over this virus. Many countries have shown us how to do that. India has shown us how this comprehensive approach can drive transmission down. The key is keeping it down. It's not losing that not becoming complacent, not losing the vigilance that we have, the resilience that we have to keep transmission down. That's the key thing right now. In Europe last summer, if you remember, we had transmission down to single digits, and then it took off again. We got a little complacent, we let our guard down, and it increased again. And that's happening now. You know, we're starting to see that because of these events, because of other factors. It's not just the Euro 2020 event or one particular event. It's a combination of factors. I hope by the end of this year, we're in a much better position because, frankly, you know, we have to regain control of this virus because we need people to get back to their lives and to resume the economic activity that all of us need.
You know, but you've said to me, hope is not a strategy. Given that, how do you see from your vantage position the situation in India? We've seen a plateauing of cases. Certainly the worst, it appears, is over compared to where we were 2 months ago when we had this horrific second wave hit the country. But there are parts of India where cases have simply plateaued. They haven't gone down. like Kerala, like parts now even of the Northeast. Do you believe, therefore, that India too cannot let its guard down at the moment?
Correct. I think no one can let their guard down. And especially in countries like India, where you have driven transmission down, it's about following through and making sure that you continue the good surveillance, continue the strong testing strategy, continue good clinical care. And I would even say surge. So in many countries, we've said over and over again, now is the time to surge capacities. Make sure your health workers have the rest that they deserve because they work so hard to care for so many. Build up that workforce, build up that surveillance system, that contact tracing system, that testing system, your sequencing systems. Now is the time to actually reinforce that because you have the will. You have the will of the people to do so, the political will, the financing, hopefully, to be able to do that because it can resurge. And so we need to maintain that level of energy, let's say, and of focus so that those numbers continue to go down.
There's a troubling question in India at the moment, which is fears over children being affected should there be, God forbid, another wave. Does the WHO believe that is being alarmist?
Well, we worry about anyone who is potentially susceptible, to this virus. Children, luckily, so far have been, they can be infected, but luckily they have more asymptomatic and mild disease. We haven't seen a change in that with any of the variants of concern. What we do see is that the variants will spread amongst populations that have the social mixing. And so in some countries, you see a shift to a younger age, but that's not because the variants are targeting children or young adults. It's a reflection of the mixing patterns. So we need to do what we can to keep children, to keep young adults, to keep all of us safe. It comes down to all of us, right? Everything that we do. Your decisions matter. You can be part of the solution. Our leaders are part of the solution. Everyone in this response, no matter where you are, no matter where you sit, you are a leader. Demonstrate good behavior, in solidarity, not only, in solidarity, but it will keep you and your loved ones safe.
So are you at all talking of a change in strategy? Should we be changing our strategy? There's talk of, mixing vaccines, that if you mix vaccines, it'll be more effective. We need a booster dose 6 months from now is also, or are you saying just stick to the basics of COVID appropriate behavior till we've got the virus under control? Or are you suggesting a change in strategy when it comes to vaccines, when it comes to boosters? Are there other things we need to do beyond COVID appropriate behavior and just vaccination?
So it's all of the above. I mean, there are a lot of studies that are underway now looking at vaccine doses and the time intervals between them, looking at the mixing of the vaccines. There are a few studies that have come out that have looked at that. For us, this is encouraging to look at the length between the dosing, to looking at the possibility of mixing. This gives opportunities. It gives us the ability to adjust if necessary. I think for us, what we talk about in our strategy is that we have this comprehensive strategy. The elements remain the same from surveillance all the way through vaccine. But the use of the vaccines needs to adapt as we have more safe and effective vaccines coming through. That's really important because there's many in phase 2 and phase 3. It's as vaccine production increases. It's looking at the time intervals. It's looking at the mixing. All of that needs to be taken into consideration. The strategy isn't static. And to me, that's a strength. We work with scientists all over the world, including many from India, who help advise us on the best path forward. And so we adjust, we tweak to make sure that it's most appropriate. But it's the fundamentals, and it's all of it. It isn't just one. It isn't vaccines only. It isn't just surveillance only or testing only. All of that needs to be taken into account and adjusted and tailored and targeted.
Okay. Final question to you. The next big sports event, I don't know whether you're a sports fan, Dr. Van Kerkhove, but if you are, is the Olympics. Are you satisfied? Are you satisfied that the world's biggest sporting event is going ahead in COVID times?
Well, I would say I'm a bit of a sports fan, although my colleagues here tease me a little bit about that. We've been working with the Olympic Committee and on their approach and the risk-based approach that they've taken, looking at the different plans that they have. But again, they are going ahead. The decision to go ahead is that of the Olympic Committee and of the country, and we support them in doing that, as we support all countries in doing so. However, what we want to make sure is that the plans that are in place are comprehensive for the athletes themselves, for all of the coaches and the support staff that are there, for the spectators that are there, to ensure that it's the safest that can occur. Right now, around the world, there is no zero risk in any events that we do as individuals or that are being hosted. We support them in taking that risk assessment, but the decisions to actually carry that forward are up to them.
Let me just get a clarity on a question, because a viewer has just put listening to this is saying some Western countries have said those who've taken 2 doses can remove masks. Is that the WHO view? I think you said very clearly you've got to continue masking even if you've taken 2 vaccines. Am I correct?
So yes, but it's setting specific. So we recommend that even people that have had their full dose of vaccine continue to adhere to the measures, including mask wearing when you're indoors, when you're around other people. Because we don't know the vaccine coverage. If you look at a global level, the vaccine coverage is very low. And in most parts of the world, there's very, very low. Less than 1% of low-income countries have started vaccination or have used the vaccine doses that are available so far. So we advise to continue to the individual level measures as the vaccines are rolling out.
Okay. Dr. Van Kerkhove, it's always a pleasure talking to you. Give our viewers a sense of comfort in troubling times. I know it's not been easy for the World Health Organization also in these times. Stay well, and I hope as a sports fan, even if you celebrate, you will celebrate with appropriate, COVID-appropriate behavior, I'm sure, in the weeks ahead.
I will be home with my family watching on television. And thank you so much for having me. It's a pleasure.
Thank you very much for joining us.